Retinitis pigmentosa is a type of pigmented retinal cell dystrophy in which rod cells are more affected than cone. Retinitis pigmentosa can be inherited in autosomal dominant form, autosomal recessive, or X-linked recessive form. X-linked recessive being the lethal. Retinitis pigmentosa appears in childhood and progresses slowly, resulting often in blindness in advanced and middle age. Retinitis pigmentosa is seen to affect males more than females in the ratio of 3:2. Retinitis pigmentosa is a type of bilateral disease. Pathogenesis. In retinitis pigmentosa, there occurs death of the rod photoreceptors. Uh, Cone destruction also occur, but in late stages. So retinitis pigmentosa is a type of rod and cone cell dystrophy. There are two types of retinitis pigmentosa. Type 1, in which occurs early and preferential loss of the rod sensitivity and diminishment of the night vision. However, type 1 retinitis pigmentosa progresses slowly and there is region-specific vision loss. In type 2 retinitis pigmentosa, there is combined loss of both the rod and the cone cells. The onset is in adulthood, and uh, later there may be in later stages diminishment of the night vision. Symptoms. The most characteristics and the earliest symptom is of that of the night blindness. So night blindness is the characteristics and the earliest symptoms which occurs before any retinal changes, any optic retinal changes through direct ophthalmoscope and indirect ophthalmoscope can be appreciated. So night blindness is characteristics and earliest and occurs before any retinal changes appear. Dark adaptation time is increased in night blindness. Tubular vision occur in late stages. Central vision is also lost after many years. What are the fundus changes which can be seen in retinitis pigmentosa? Jet, jet black spots resembling bone corpuscles can be observed on the retina. So you can see here jet black spots or resembling bone corpuscles, black jet spots, black dots on fundus changes. Also, there is the narrowing of the renal arterioles. Retinal pigmented epithelium becomes atrophied and becomes thin. However, the retinal pigment epithelium on the macula is spared. The optic disc becomes pale and it becomes waxy in texture. What others can be seen? Cystoid macular edema may or may not be present. Choroidal sclerosis may or may not be present. What are the visual field changes in retinitis pigmentosa? There occurs the presence of the ring-shaped scotoma. Why ring-shaped scotoma? Because in retinitis pigmentosa, first there occurs the destruction of the pigment cells of the peripheral retina. So there occurs the ring-shaped scotoma. What are the electrophysiological changes? The electrophysiological changes appear early before any subjective or objective symptom appear. This is the normal electroretinogram. You can appreciate the A wave and the B wave, which is this is normal. So in retinitis pigmentosa, the A and B waves disappear, so the electroretinogram becomes flat. Moving on to the final, what is the treatment of retinitis pigmentosa? Vitamin A has been tried to check for the progression of the retinitis pigmentosa in a dose of 15,000 international units 4 times a day per oral. For cystoid macular edema, to resolve the edema component, acetazolamide can be tried. Acetazolamide is given 500 milligram. Correction of the refractive error if present. Various measures have been put into practice, such as the use of vasodilators, placental extract transplants of the rectus muscle in suprachoroidal space, and acupuncture. Stem cell therapy have been tried, gene therapy trials, low vision aids, and the prevention of any consanguineous marriages, the marriage between the family, like brother and sister marriages. Consanguineous marriages are a risk factor for the development of the retinitis pigmentosa, so consanguineous marriages should be avoided. So that's all about retinitis pigmentosa, the main points.